Hello everyone, welcome to my channel Nursing Cafe. If you have not subscribed my channel, please subscribe my channel. If you like this video, please click the like button. And if you have any queries related to my topic, you can ask or comment below. Moving to today's topic, nursing management of patient with disorder of ears. So we deal with some disorders of ear. Before we study ear disorders, we must know other things related to this. So in this video, we will review about some contents. And the content of the videos are: the first is anatomy of ear, and the second is physiology of ear. Third is terminology, some terminologies related to our ear. Fourth one is The fifth one is physical examination. What are the methods of physical examination for a patient of ear disorder? And the sixth topic which we will study in this video is investigation and diagnostic evaluation. This will enable us to how we can investigate and diagnose various conditions related to ear disorders. These are the contents which we will study in this video. In continue the disorder of ear, we will study that thing in my next video as second part of this. So we should start our topic. First topic is anatomy of the ear. This is the structure of ear. Okay. In anatomy of the ear is divided into three parts: external ear, middle ear, and internal ear. So first we will discuss about external ear. External ear have three parts: auricle, which is commonly known as pinna, external auditory canal, and a eardrum. Eardrum is also known as tympanic membrane. This portion here, this is the pinna, also known as auricle. Okay, this is the external auditory canal, or it is known as ear canal. This is the auditory canal, and this is the eardrum, or known as tympanic membrane. This part consists the external ear, and the other part and the second part of the ear is the middle ear. Middle ear consists of two parts: bones, or known as ossicles, and the other is eustachian tube. The ossicles are further divided as malleus, incus, and stapes. Here you can see the malleus is directly attached to the eardrum or the tympanic membrane. It is hammer-shaped structure, malleus. And the next is the incus. Incus is just attached to the malleus and the stapes. Okay, it is avil shaped, AVIL shaped. Okay, the next is stapes. Stapes is just like stirrup shaped. Okay, these are the middle ear parts, and this is the eustachian tube. Okay, it maintains the air pressure in the ears. Okay, and moving to the internal ear. Internal ear has three parts: cochlea, semicircular canal, and vestibule. This is the cochlea. Okay, it is involved in hearing. The next is semicircular canal. This is of three further types: anterior, posterior, and lateral. There are two windows: oval window and round window. and a cochlear duct. This structure is known as vestibule structure. Okay, these are our anatomy of the ear. Ear is divided in three parts: external ear, middle ear, and internal ear. External ear consists of auricle, the pinna, external auditory canal, eardrum or tympanic membrane. Middle ear consists bones or known as ossicles that are malleus, incus and stapes. And the middle ear, another part is eustachian tube, which helps the air pressure maintenance. And the last is internal ear, that consists cochlea, semicircular canal and vestibule. Semicircular canal is further divided into anterior, posterior and lateral semicircular canals. So this is our anatomy of the ear. Our next topic is physiology of ear. The next topic is physiology of ear. In this, the air is collected by the pinna and transfer that sound or mechanical response to the auditory canal. The auditory canal further moves that mechanical response into the bony ossicles. Bony ossicles that convert that mechanical response into the electrical signals. And in bony ossicles, it consists of malleus, incus and stapes that helps the mechanical response to convert into electrical signals, and after that electrical signal moves to the oval window and round window, and after that oval round window it moves to the cochlea, and at there a auditory nerve is present that converts into auditory signal, and after that auditory nerve transfer that signal in the brain in the temporal region. So after that we can hear a proper sound. Through the diagram we can see the air which will collect in the ear auditory canal. After that the air will move to the eardrum. After eardrum or the tympanic membrane, it will move to the ossicles, malleus, incus and stapes. After stapes there is a oval window. After crossing the oval window it will go to the cochlea, and after cochlea it will come to the round window. Okay, after this round window it will go to the auditory tube where the auditory nerve is present, and it will take that signal to the brain, and the brain will interpret that sound and tells us what the meaning of that sound. This is the physiology of the ear. So our second topic is also completed, and moving to the third topic, which is terminology. There are some common terms which are used and related to ears. So the first terminology is otology, which means the study of disease of the ear. Means that there are so many diseases which can occur in the ear. When we study about a particular disease of the ear, it is known as otology. Okay, moving to our next terminology, which is Otalgia, which means pain in the ear due to any disease of jaw joint, neck, throat, or teeth. Due to any of the above diseases condition, the pain of that particular area will radiate to the ears, causing ear pain or earache, and this condition is known as otalgia. The next one is tinnitus. which means the sensation of sound in the ear or ringing sensation in the ear. When someone feels some ringing sounds in the ear, that condition is known as tinnitus or tinnitus. The next one is vertigo, which means swimming of the head, or we can say it is the feeling that you or your environment is moving, spinning, or whirling. We will briefly study about this topic later when we study about the diseases of the ear. So, moving to our next terminology, which is Autorhydia, which means any discharge. It may be liquid fluid, which is from the external auditory meatus or the ear. The causes of Autorhydia may be various, maybe any kind of uh, trauma or rupture of the tympanic membrane. So, moving to the next terminology, which is Autorhydia, which means bleeding from the ear. We have noticed that in all medical terms, when the last word is the ending word is IA, so that is related to the blood. Always note that point. So, moving to our next terminology, which is Otomycosis, which means a fungal infection of the ear causing irritation or inflammation in the ear. The next one is deafness, which means loss of hearing. It may be from birth or acquired due to many causes, and the loss of hearing is all known as deafness. The person who has not the ability to hear anything due to any causes, the person is known as deaf. So, moving to our next terminology, which is otoplasty, which means surgical and reconstruction of the ear due to any damage or any other causes. The ear may get damaged. To treat that damage of the ear, we do surgery or other reconstructive techniques to the particular area. That's known as otoplasty. The next one is otorhinolaryngology, which means the study of ear, nose, and throat related disease or disorders. The next one is it is the last terminology audiometry, which means an apparatus which is used in measuring hearing. Okay? So these were some common terms used in this unit. Moving on to the next topic, which is assessment. It consists some steps which we will discuss in this topic. So the first one is health history. It includes all the components that are applied in other body system. It covers all the organs disease history. If someone has some organ disease in his past, so to understand if any disease or disorder were in their past or not. Next is identification. We should try to understand the patient's conditions by the symptoms which the patients are saying or the family members of the patient are saying. That will help us to identify the correct disease condition which is affecting the patient. So identification is main in the assessment. So the next one is chief complaint. We have to assess the chief complaints of the patient, which will help in diagnosis and treatment. Because the chief complaint consists of many symptoms that the patient is having. So it will help the nurse or the doctor to understand the real condition of the patient or the client. Next one is history of present illness. To know if any serious diseases the patient is facing, or if the person have any other conditions presently, so to know that present illness. The next one is history of past illness. To know in past any surgery or any type of problem was there or not in the patient. This will help the client, the doctor and the nurses if the problem was from the past or not. The next one is current health status, which includes current medications if the person is taking any kind of medicines while from before he comes to the doctor. The nurses or the doctor should know about that current medications which was taken by the patient, or addictive to drugs if the patient is drug addicted person. The health status should the current health status is very important at that case, or or have any allergies, because allergy can cause severe disease. So the next one is family history. If the patient's family have any type of ear disorders or disease, so it may have chances to transfer that disease condition to the young other generation. So to know that disorder, the nurses and the doctor should know about the family history of the patient. The last one is psychosocial and personal history. How the person behave socially or mentally, how much strong he is, or mental history of that person, or the personal history of that person is also a very important assessment skill. So these all were the assessment steps or the techniques by which we assess the patient for their disease conditions. Moving on to the next topic, which is physical examination. The external ear is examined by the method of inspection. Inspection is done to assess the external ear for the presence of scar, if there is any scar, lesion, and to see the symmetry of the ears, they are symmetrical or not, and to see the attachment, the ears attachment with the skull, or any other abnormal discharges are there or not, or the color of the skin texture, etc., are inspected in the external ear. The external ear also includes the tympanic membrane is inspected with an otoscope. While inspecting with an otoscope, the nurse have to steady the hand against the patient's head to avoid the insertion of the otoscope too far into the ear canal, which may cause another disease condition or may rupture the tympanic membrane. To avoid that, the nurse have to do this thing. Next, the middle ear. Next is the middle ear. The middle ear is inspected with an middle ear endoscopy. Direct palpation is for knowing any tenderness or presence of malignancy, free movement, circulation, etc. To know these things, we use the direct palpation method. And the other tests are tests for Eustachian tube patency, which was the part of the middle ear. The next is labyrinth test. Next is mastoid x-rays, blood tests and cultures, which the sample is taken from the ears for doing the test or cultures. These were the physical examination done for the ear testing. The next topic is investigation and diagnostic evaluation. That's the last topic of my video. The physical examination is over. The next topic is diagnostic evaluation. In this, the first is hearing screening. Okay, these are done to evaluate or investigate or diagnose the different disease condition of the ears. The next is tuning fork test, Weber test, Swaback test, audiometric test, pure tone audiometric, speech audiometric, test for vestibular function, rotation test, caloric test, electronystagmography, radiological examination, mastoid x-ray, blood examination, culture. These all investigation and diagnostic evaluation are done to check the ear is working properly or not. If there is any variation found in these values, then we can say that the ear has some disease or disorders which may affect the rest of the organs or the organ system. So here my topic finished. Thank you for listening me, spending some valuable times for my video. So I will return with my second part of this video, which will be disease of the ear. These were the contents: anatomy of ear, physiology of ear, terminologies, assessment, physical examination, investigation and diagnostic evaluation. If you have not subscribed my channel, please subscribe my channel. If you like this video, please click the like button. If you have any queries, so please comment on the comment section or ask. Thank you.